All right, so I am in the med room. We're going to be doing Marchex 1 and 2 right off the bat for some eardrops that we have to give Casey. So we have Casey Banks, 10/2/1965, allergy to aspirin. We have an order for carbamide peroxide, and I'm grabbing carbamide peroxide, 6.5% and 6.5% for the left ear. These are earwax removal drops for use in the ears only. BID, we're going to give 2 drops. This is a brand new container, so I should have enough drops in there for the patient. Due at 0900, it was not given at 0900. This expires December 2024. And this does not contain aspirin in it. So Marchex 1 is good. I'm gonna do Marchex 2 again. So Casey Banks, 10/2/1965, allergy to aspirin. We're giving carbamide peroxide. I have carbamide peroxide, 6.5%. 6.5%. For the left ear, I have earwax removal drops, BID. We're going to give 2 drops in that left ear. These are earwax removal drops for use in the ears only. I have enough drops in here for what we're gonna give. Do it 0900. It was not given at the 0900 due time. So I have my eardrops here. I'm gonna bring my MAR with me. I have a cotton ball, some tissues, and a washcloth, and I'll bring my gloves in as well. So we're gonna go knock, knock. Hello, my name is Sarah. I'm the nurse taking care of you today. Can you just state your name and your date of birth for me, please? So we have Casey Banks, and I see Casey Banks, and 10/2/1965, 10/2/1965. Do you have any allergies, Casey? Casey says he's allergic to aspirin, and I see an aspirin allergy on the wristband and also on the MAR. Okay, Casey. So, I hear that you have been having some earwax buildup. Is that correct? And Casey says, yeah, it just feels like his ear is really full. All right, so the team has prescribed some eardrops for you to help loosen up that earwax buildup. It's called carbamide peroxide. Have you ever heard of that before, or have you ever received it? Casey says no. So what it's going to do is it's going to get instilled into your ear, and it's going to slowly dissolve that earwax, soften it up so that your ear will naturally start to expel that, and you should start to feel a little bit better. You might hear a bit of a bubbling or a crackling. That's just the noise of the medication doing its job and loosening up that earwax for you. Do you have any questions before we begin? Casey says no, so I have the patient supine right now. It'll make it easier for him to turn his head to the side. I'm going to do my 3rd Marchex before I do my assessments and everything, just to get it out of the way. That way I don't forget about it. So we have Casey Banks, 10/2/1965, allergy to aspirin. Today we're giving carbamide peroxide, and I have carbamide peroxide here, 6.5%, 6.5% for the left ear. These are earwax removal drops for use in the ears only. BID, we're giving 2 drops. This was a new container, so I have enough drops to give. Do it 0900. It has not been given today at 0900. It does not contain aspirin in it, and I'm going to roll my eardrops. So Casey, the reason why I'm rolling this, we want it to be at room temperature. This is going to help warm it up. And when we give the warm drops, that decreases the risk of feeling dizzy or nauseous or lightheaded when we give this into your ear canal. But if you do feel any of that, I do want you to let me know, okay? So rolling my eardrops, because remember, if we don't roll them before we give them, that is considered a medication error. So I'm just going to set that aside. We've done our Marchex 3 hand hygiene, and I'm going to get my gloves on. Before I give you your eardrops, I'm just going to assess your ear. So I'm verifying I have the left side of the patient. I'm going to have you turn your head over to the right. And I'm just going to palpate here. Is there any pain if I press here? And Casey says, no, it doesn't hurt at all. I'm looking around, looking for any redness, any drainage, and I do not see any of that. There's no pain, redness, swelling. I do see a little bit of earwax built up though in the ear canal, so this should help again with that. I'm just going to clean the outer ear before we give this medication. So this is a warm washcloth. I'm just cleaning that outer part, getting any kind of debris that I can out. This is going to go in the laundry then. So I'm going to just double check. We're doing 2 drops in the left ear. So I'm going to unscrew the cap just like that. I don't want to cross over the tip of the syringe or the exposed part of the lid, so I'm setting that down on a tissue. Okay. All right. So I'm going to rest my dominant hand on your cheek here. No. My non-dominant hand on the cheek. And then I'm using my dominant hand to pull that pinna, so the upper part of the ear up and back. And I'm going to give one drop. I'm going to massage the tragus, so I'm not dropping this directly into the ear canal. I'm just letting it slide down the side. And I'm not letting the tip of the syringe touch the ear, otherwise that would contaminate the medicine. Okay, and we're doing another one. And massaging. Okay, I'm going to set this over here. Casey, I'm going to put a cotton ball in your ear. This is going to help hold the medication in. I'm going to keep you on your side for 5 minutes. That's going to help the medication get absorbed and soften up that earwax that you were having. So while we wait for that, I'm going to do my hand hygiene, and I'm going to document that I gave this medication in the left ear. So I have L ear and 0900 SE. Okay, I'm going to recap my medication just like that. This is going to go in the garbage. This will go back in the patient's med cabinet or the med room, wherever they store their medications on the unit. So we have that. I'm also going to document my assessment piece from the ear. So there was earwax buildup, but there was not any redness, drainage otherwise, swelling or tenderness there. So again, Casey, we're going to lay on your side for 5 minutes. I will come back after that time is up to remove that cotton ball, and then you can put your head back to normal. Okay, so call light will be given to the patient, side rails are up, and bed is locked.